Cosmetic dentistry. You do a lot of cosmetic dentistry in your practice. So veneers, tell me a little bit about the process. Who's a candidate?
Well, we see the typical candidate for veneers is a patient that comes in, they have some teeth that maybe have crooked in some areas, the canine, or another tooth sticks out a little bit further, and their overall smile line, they don't have bad decayed teeth, but they're just not shaped up the way they want it. So they don't like the way their smile is, uneven. So we bring those patients in. We do what we call a mock-up to see how the end result will be. And both of us look at it, then patients say, look, I like it and we like it. And then we go ahead and make some temporaries. They get to wear them for a few weeks.
Like a try-in smile kind of thing?
A try-in smile. And one thing I like about that, we can tweak it and perfect any little small area that they might say, let's shorten this tooth a little bit. Let's do this. Make this a little longer. That's the time we trial. Now, the cosmetic dentistry is an art. And that's part of the dentistry that I actually love, because you got to be able to visualize it and see it in order to get the good end result. But we do that every day. When they come back in and get that smile and they get the teeth that wanted, the veneers, they're so excited and they start smiling as soon as they see that mirror. I say, give them the mirror, it's time, it's showtime, and they get so excited. Now, my wife is one of those people. She thought she had some issues, that she was getting older. She felt like she was aging because her teeth changed a little bit and the colors and so forth. And we said, well, you are a good candidate for veneers.
Let's take a look at that photo. You showed me those teeth. They're pretty good, but at a closer look, I guess there's like the tips are a little bit like worn off.
The tips look worn off. They looked a little shorter than they used to. And I've been married to her, and I didn't know why they were shorter. I'm a dentist. But once we looked at them and said, they're a little shorter, they're a little darker, let's see if we can do a smile makeover. And she agreed, and once we did that, you see this kind of smile she has now. She had people asking her,
very nice.
Well, who did that? Your teeth look so beautiful. And this is just one example of I got cases like that, cases and cases just like that.
And those teeth look natural. They don't look like big and bulky, like what you would think veneers would look like.
Well, I want to have you take a closer look at it. If you see the canines look curved or her two center teeth look rounded a little bit, they're for women. Women have more curved teeth than men, and that was custom made for her smile. And now she likes it because they don't look like they're false teeth. They
That's
look
a great
natural,
smile.
And they look natural. And nobody knows that she has veneers, but they just know she's got a white, pretty smile.
Now, in North Carolina, I guess a dentist's wife legally has to have a beautiful smile.
It's a requirement. You
requirement.
have to have a beautiful smile. Do you got some problems?
So there's a lot of people that just don't like their smile.
Yes.
And the cosmetic or veneers or bonding or whatever are the way to go.
Absolutely. We've been doing that for years and it works. I've done lots of patients like that.
Like thousands of people.
Thousands of patients like that over the last 30 years or more. And they're still enjoying it.